Hello, I would like to introduce myself to those who I have not had the opportunity to meet. I am Dr. Raul Vasquez and I am the Medical Director for Helen, Henderson and Carveth Care Centre of the Gibson Family Healthcare. These are most certainly unsettling times, and if you or a loved one who resides at one of our homes, I am sure there are concerns about the health and well-being. I wanted to take this opportunity to talk to you about what we at Gibson Family Healthcare are doing to keep you and your loved ones safe during this pandemic. Considering recent news of COVID-19 outbreak at other nursing homes in the province, I am sure this anxiety is amplified. Currently, we at Gibson Family Healthcare are following the legislations laid out by the Ministry of Health and Long-Term Care. Our administration team and staff are meeting daily to review the legislations and focus on operation and infection precaution. The attending physicians are doing everything we can to keep residents safe while managing current health care needs. Details of what Gibson Family Healthcare is doing have been sent out in communications and will continue to be sent out in the coming weeks. We currently have no suspected or confirmed cases of COVID-19 at Helen Henderson Care Centre or Carveth Care Centre, but I feel it's imperative to be vigilant and prepare for the worst case scenario. Because of this, I wish I had the opportunity to discuss with you face to face about your goals of care in the unfortunate event you or your loved one develop COVID-19. Unfortunately, in the world of social distancing, this video will have to be enough. There is no cure for COVID-19 and treatment offered is supportive in nature like oxygen therapy. As you likely know, older adults and those with other chronic illnesses are at increased risk of severe illness and even death. There may come a time when you are faced with a difficult decision for you or your loved one. At Gibson Family Healthcare, we focus on resident-centered care. So it's very important for us to understand the wishes of you and your loved ones in the case of developing COVID-19. Goals of care were likely discussed at the time of admission, but most likely in the coming weeks you will receive a follow-up call for ongoing discussion. Now more than ever, it's important to have this discussion with your family and express your wishes to our staff. At Helen Henderson Care Centre and Carveth Care Centre, we can offer supportive care which includes oxygen therapy and medications to help manage the symptoms. Transfer to the hospital is not always the best option and may not even be an option depending on the clinical scenario. It's possible, but it's not the resident's best interest to be in an unfamiliar setting exposed to other pathogens. Intubation and mechanical ventilation can be very risky in a frail elderly patient, especially in the setting of COVID-19. Recent statistics shows that the likelihood of survival once ventilated in the patient over 80 years of age is about 3%. These can also come with undue suffering that is prolonged and a potential loss of dignity. I strongly urge you in the coming days and weeks to spend time thinking about what it is in your and your loved one's best interest when it comes to ongoing medical care. Once communicated, the healthcare team at Gibson Family Healthcare will work together to follow the wishes and goals of care of the resident. Please, if you have any questions or concerns, feel free to contact our registered staff or attending physician. I wanted to thank all the staff, support workers at Gibson Family Healthcare team for their continued and dedicated service. We are all in this together. Please stay safe, stay home, and maintain social distancing. Thank you very much.